Well, good morning, everyone. Thank you for joining us today. My name is Debbie Madeley. I'm the Development Director at the North Suburban YMCA. It's my pleasure to welcome you to this presentation on healing hip pain naturally, hosted by Denise Schwartz. Denise is a licensed physical therapist and specializes in treating pain using a holistic approach to discover the root cause of the pain and natural healing options. The Y Education series is free and open to the public, and as a 501c3 charity, we do rely on fundraising to support the community service work we do. If you do like the presentation and would like to support the program, feel free at any time to send a donation to the Y. We very much appreciate that. These presentations typically last about an hour. Maureen will take questions both at the beginning and at the end or throughout the presentation if you have them. We do ask that you could, again, mute yourselves during the presentation. But enough about the why. We are here to learn about healing hip pain naturally. So with no further ado, here is Denise Schwartz.
Debbie, you might need to make me as a host so I can share my screen, or maybe it's already.
It should be.
It's probably okay already. Hold on.
Yeah, I think it's all set. Yeah.
Okay, I got one more. Don't go anywhere just yet. I gotta do one more thing here. Oops, that's not what I want to do. Usually, oh, can you see my mouse moving around?
Yes.
Oh, really? Okay, then we're fine. All right, well, I guess it's not morning. It's good afternoon, everyone. My name is Denise Schwartz. I'm a physical therapist and owner of the Manual Touch Physical Therapy here in Wheeling. I cannot see anybody. I can't see myself at the moment either. So if you have any questions, please put it in the chat box and we'll get to all of them at the end of the session. You know, obviously, if we were in person, it'd be wonderful. We can introduce ourselves and we can interact a little bit more. But as you know, over the last couple of years, that's a bit of a challenge on a webinar. As I said, I am the owner of the Manual Touch Physical Therapy in Wheeling. I'm at the corner of Milwaukee and Dundee Road, so just outside the border of Northbrook. So we can almost say I'm Northbrook. I've been doing these webinars for the Northbrook Y. Oh gosh, it could be 5 years now. Karen Brownlee, who started it, said I was one of the first ones on board. So it's at least 5 years, and I've really enjoyed my time and really appreciate being able to educate the public about what you can do for yourself when you have pain. Today, we're going to talk about healing hip pain naturally. And I'm going to talk a little bit more about myself here. So our company uses a whole body approach of traditional and non-traditional physical therapy to get people back doing the things they love to do. I started my career over 30 years ago. I worked at Lutheran General Hospital. I saw people in the hospital for a couple of years, and then I concentrated my career on outpatient, which is what I'm doing now. And that's where you come to see me at wherever I'm working. When I got out of school in 1988, I knew that back pain was the #1 reason people went to see their doctors. And I took a lot of continuing education classes to become an expert in treating back pain. I also took lots of classes all over the years to treat everything in the body. And what I found along the way, I started learning this non-traditional therapy called integrative manual therapy. And it's about looking at the body as a whole and what is preventing someone from healing, where in the body, it's not just about treating the symptoms. And I found after a couple of years of taking these classes that I was doing more and more of the integrative manual therapy, this non-traditional approach, and I was getting results with people that I never could get results with my traditional therapy. People with chronic pain, chronic illness, fibromyalgia, those kinds of people. Anybody who's had kind of a major trauma, sometimes it's challenging. They need a little bit more of a non-traditional approach. So after about 14 years, I left the hospital and I started the franchise of Center for Integrative Manual Therapy here in Chicago with my mentor from the hospital. And I worked with them for about 7 years, really focusing on really treating complex patients with complex medical issues, complex physical issues, people who don't get better elsewhere. And then 12 years ago, we parted ways and I opened up my practice, the Manual Touch Physical Therapy, in the same place. And along the way, I developed a passion for running. So I became an expert in treating runners and triathletes as well. My son is a triathlete. So I have quite a bit of continuing education, over 34 years, a lot of different experiences, and being able to integrate all these different approaches. So today we're going to talk about hip pain. And I noticed initially who we got on was mostly, I think there were mostly women who came on. So I'm really glad you're here. They seem to have the most trouble with hip pain, and we'll talk about that, why, in a little bit. So the 3 most common causes of hip pain that we see here are either, are some form of arthritis, degenerative joint disease, a tendonitis or bursitis. And then I have to tell you, the most common is just general weakness. Now, when you have a tendonitis or arthritis, you're going to have weakness because you're not going to use the muscles as well. Where do people have hip pain? This is a really important question. Everybody describes their hip in different places. Some people say their hip is in their buttock. Some people will say the front of their hip. Some people will have pain down in their groin, and some will have on the side of the hip. So all those pieces, knowing where you're having your symptoms, leads us to why you're having a problem and what the problem might be. Common complaints that I see, people have pain with sitting. So someone sits in the car or they're sitting in a chair for a half hour, they stand up, they have hip pain. Someone who is standing for 10 minutes or 15 minutes might say their hip hurts. Someone might tell me when they're walking, their hip will hurt on the outside or on the back, sometimes in the front. Some people will say it hurts when they lay on their side. They may have difficulty putting on their shoes and socks. They can't bend down or squat. They can't run, play pickleball, tennis, bowling. They just can't do the things that they love to do. A common complaint is I just feel less mobile. I feel really stiff. Even rolling over in bed could be a problem. Sometimes people come in and they have back pain, but it's really coming from their hip. Sometimes they have thigh pain and it's really coming from their hip. So all those clues of what you tell us give us a clue to what may be causing the problem. So I would suspect that those of you who are on my call today are because you're having some hip pain or you know someone who has it. So this is an ebook that I have that if you put your name, your full name and your email in the chat box, I will be happy to send you this ebook as well as a copy of the PowerPoint today. And this ebook is tips for how to go about your day and do all those things that we just take for granted. We just get up, we sit, we stand, we move around. Nobody's ever taught how to do those things. I had a man, an 80-year-old man last week say to me, he's like, for 75 years, I didn't know, I just walked. I didn't need to learn how to walk. But he recently had some hip surgery. It was actually to reattach a muscle in his hip. And now he has to learn how to walk and really think about the different pieces. So possibly the only profession where you learn how to move and take care of yourself is in physical therapy school. So that's what we do, is really reteach you how to use your body again. All right, so let's talk about the hip. This is a picture of the front of your hip. If you took everything off in the front and we were looking inside, we're going to see inside the hip. Okay, so here you can see this is your spine. This is your pelvis. And the pelvic bone, the pelvis is divided up into 3 bones. They're all fused together, but this top part of the pelvis is called your ilium. And then down here is your femur. And you can see over here, it might be easier if we look at the bones here. This femur, you know, it's the longest bone in our body, and it takes this turn in here. And this is called the neck of the femur. And the ball of the femur sits in a socket, and the socket itself is called the acetabulum. And that's in the ischium part of the pelvis. This is the pubic part of the pelvis. So this is what we call a ball and socket joint. It kind of looks like so. When someone has degeneration or arthritis, that space between the ball and the socket narrows up and you can't move like you're supposed to. That hip, the ball and socket joint, has multiple ranges of motion and can move in all different directions. The shoulder joint is very similar as a ball and socket joint, so you have a lot of different movements. Unlike the shoulder, the hip joint, you know, is surrounded by some really powerful, strong muscles. So it's not a real unstable joint, where unlike the shoulder where you have these little muscles around it, and you can get a lot of instability in there. I'm not sure why I don't have these muscles labeled, but I think I'll have to fix that in the picture. But this is your hip flexor muscle, which is known as your psoas, P-S-O-A-S. And you can see it attaches on the inside of your spine, and it comes through your gut, crosses your groin, and attaches onto your femur. And this is what muscle that lifts up your leg, like you're lifting up your leg to step onto a step. It also is, you know, obviously when you're sitting, it kind of folds up. So if you're having a pain in the front of your hip, oftentimes it's this muscle. So when you go to stand up, it doesn't want to stretch like it needs to, and it kind of will spasm on you, and that's where you get that pain. On the inside of your ilium is your iliacus, and it comes together with the psoas here, and they work together, called your iliopsoas. These are your adductors, and those are your groin muscles. Those are on the inside of your thigh. This is the back end of the hip, your posterior hip. So you can, this is the bottom part. This is your sacrum. Here you can see this is your sacrum. It's the bottom of your spine. And these are the muscles on the back side of your butt. Okay. So here we have your ilium. This is called the ischial tuberosity. Down here, this is a bone, or some people call it, layman's term is the sits bone, because that's what you sit on. What's missing here is your big gluteus maximus. So a lot of people have heard of that. There are actually 3 gluteus muscles. The glute maximus sits over all of this, but underneath, and that's your big, powerful butt muscle, okay? So when you jump, that's the glute maximus. But more importantly are the glute medius, that's underneath here. It's kind of cut off here. Let me see. Okay, and it comes across actually and goes across here, all right? This is the muscle that helps you stand on one leg and stabilize. When this muscle is weak, which is weak on almost all women, particularly anybody who has any problem in their hip, this could be weak. Let's say you have a knee problem or a foot problem, this becomes weak because you're favoring the leg because you might have pain somewhere else, and this isn't helping you because you can't activate the way you need to because you're having pain somewhere else. These little muscles under here, the gemelli, we call them the gemelli brothers, gemellus superior, inferior, the quadratus femoris, and the obturator internus. I think we're missing the obturator externus. These little muscles rotate your leg. So if you were to lift up your leg to put a sock on, so you're going to cross your leg in order to reach your foot, that would be a rotator muscle. one of these muscles would do that. However, their primary role is to stabilize this whole pelvis as you move through the world. And I have to tell you, 9 times out of 10, when I have a patient come in here with pain almost anywhere in their body, hip, back, knee, foot, even shoulder, it's because these muscles are weak. My runners, my triathletes, my older folks, my 40s to 50-year-olds people, most people are weak here. This is part of your deep core muscles. I'm sure a lot of you have heard the word core. Here is your core. It goes every muscle from your diaphragm, which is up here, to the pelvic floor. Those are all your core muscles. Those little ones that I was talking about are part of your deep core. And these are some more of the superficial. You know, here's your 6-pack that we all have. Some we can see them on people and some we can't, but you do have it. But the most important one is your transverse abdominis, which is a large banded muscle that goes all the way around, and it helps stabilize your core as you move through the world, as you function. So activating those deep core and your transverse abdominis is key to healing. I had actually one of my best friends during COVID when we shut down. She had just retired from teaching, and she's always worked out every day, but she really worked out a lot more. So she was doing like 5 miles in the morning and 5 miles in the evening. So walking almost 10 miles a day, and ultimately wound up with some pretty bad hip pain. I took a look at her, and it was strained glute medius, but really it was because she was super weak in her pelvic floor. So I had to give her really specific exercises for this pelvic floor. Now she had actually gone to another therapist who was really poking around here, gave her some of the basic hip exercises, you know, sideline, raise up your leg, clamshells, bridging, and it just wasn't getting to it. He had missed that he needed to work on this pelvic floor, and he had missed having her work in standing. So you're really working more functionally. So it's very important if you wind up going to therapy and it's not with me or my other therapists, that you talk about this pelvic floor with someone and make sure they're exercising that. Okay. This is another picture, a deeper picture of your spine and your sacrum. This is actually, which I didn't talk about, was this piriformis muscle. Piriformis muscle gets a lot of news. A lot of people say when they have pain in the butt, it's your piriformis syndrome. I have to be honest, I've been doing this 34 years, and I often don't find that this is the problem. Yes, it is strained, but it's usually a problem here in your sacroiliac joint, where you get this joint is not in balance the way we want it. The joint is a little out of, I don't want to say out of alignment, but it's tight in one component, and thus it pulls on that piriformis, which causes a tightness in the butt, which then might press on your sciatic nerve, which comes down underneath it. So what we need to do is work on this joint to better balance out this joint, which in turn will relax this muscle and therefore won't press on this sciatic nerve. Okay, so let's get to our 3 most common causes of pain. Number 1, that a lot of people, when they have hip pain, they think right away they must have arthritis or there's something going on deep in their joint. How does someone present who has arthritis? Usually when it's pretty far along and pretty degenerated, they will have pain in their groin. It is radiating down in the front. When they will have significant weakness, then one of the big telltale signs is you will see a real change in their gait. You will see a noticeable limp. I will see people, they'll walk like this, when they get on that leg, they kind of side bend their body. It's a pretty telltale sign that there's something going on in that hip. Or I've had a couple of younger people, and younger being upper 50s, 58, 59, 60, where they're just stiff. That whole back is stiff and the hips are stiff, and they just kind of move through the world like with very little movement and just kind of like this big block, and their legs are moving. The way I can tell when someone comes in, I'll see those things, and that clues me in that it's probably some arthritis or degeneration. When I get them on the table and I move their leg and check the mobility of their joint, there was always significant loss of mobility in one, probably two directions. Number one, they cannot rotate their leg in. So when, do you know how kids sometimes sit in a W? That motion is called internal rotation. And when I assess that, like if I'm holding a leg, it's hard to show here, and I turn it is to try to get them into W sit, we can't go anywhere. That joint just stops. The other motion that's really common loss is extension. That would be bringing your hip behind your pelvis. Let me see if I don't think I have so extension would be, this hip is behind your leg. Okay. So if you don't have good hip extension, you don't have that internal rotation, that affects your gait significantly. And then you start compensating all over the place in different places, and you wind up with back pain or even shoulder pain anywhere. I've had people come in where they've had pain in their back or their SI joint. And when I look at them, I had this one woman who came in, and she had been seeing a chiropractor for years. And for a few months or maybe even a year, chiropractic just wasn't working anymore. So she came in to see me. And that's a big clue. If you're getting the same treatment week after week and it's not working anymore, something else is going on. And if your practitioner isn't looking for something else, you need to go look somewhere else for an answer. When she came into me, I told her at the first visit, I think it's your hip joint, you need an x-ray. She was really resistant. She finally went in maybe 4 or 5 weeks later, and ultimately with a total hip, she needed a hip replacement 3 months later. And she was an older woman, maybe in her 70s. I did have a young woman come in. She was about 52. And when she walked into my clinic, the gait deviations, that's a technical term for walking funny, was so significant. I knew right away she needed to see a surgeon. But she came in, she's like, I've been Googling on the internet. I think I have a labral tear. I have a impingement or something. And, I knew in my head right away that there was more, that's what it was. And it was not that. But, I did my full evaluation, and I'm like, you need x-rays ASAP. I think you need total hips. When someone comes in at the age of 52, this is usually something you were either born with, and it just, you're born with a hip problem that doesn't really show up until you get older, or you were a very active elite athlete when you were younger, and this is finally taking its toll. She also was resistant to get x-rays, didn't want to believe me. After about 3 or 4 weeks of treating her, because there were some other things that we could work on to help her with her pain and get her stronger, I'm like, I can't see you anymore until you get an x-ray. She finally did, and she ultimately needed both hips redone. So it's very important. I was just telling Debbie before we started that when someone really needs a total hip, if a doctor tells you you're bone on bone, or it's really moderate to severe degeneration, you can't wait it out. These people are really, really uncomfortable. You can't live with it. I just don't see people being able to live with this. People who need a total knee, let's say they're bone on bone, I've seen people wait years before they can tolerate it for a long time. Someone with a shoulder rotator cuff problem, you can live with it for a long time before you need surgery. But a hip, If you really need it, you need to get it. There isn't much we can do for you. When you come in early on and it's not bone on bone and there's still mobility, there we can help you get stronger, help manage your pain, make sure, you know, when you finally do have to have surgery, that you will be in the best condition that you can be. But when it's already bone on bone, there isn't much that we can do. I wish we could. But when people have it done, they're doing, you know, the surgery for a total hip these days is really phenomenal. Uh, the people are walking, you know, you're going home the same day. You're you know, they get you out of bed. You start walking the same day. You use a walker for a week or two. Some people go to a cane pretty quickly. So people are doing very well. They've really made some really good progress with total hip joint replacement. And I also tell people, you know, don't wait too long. I know it used to be that surgeons will tell you wait as long as you can because we don't know how long the prosthesis will last. However, I think the prosthesis are lasting a lot longer, 20 to 30 years now. But the loss of quality of life is not worth waiting as long as possible. The second reason is you will lose strength. You're going to lose mobility. You're going to develop so many compensations that it's very hard to get back as strong as that you want to be. So we don't want to wait too long. One of our best friends who is, let's see, she must be 81 now. So let's say this was 3-4 years ago. She used to walk 5 miles a day, no problem. And then she noticed she was having difficulty on stairs. Something didn't feel right. She wasn't in a lot of pain, but she went in to get an x-ray, and he's like, well, you know, you're almost ready for a total hip. It's almost on bone. And she opted to get the surgery right away, even though she wasn't that uncomfortable. But because of that, she looked like she never had a hip surgery because she never developed all those compensations that you have before you have the surgery. So, and at her age, there was no point in waiting, right? She's 78. If it lasts 25 years, that's awesome, right? So that was a really good call on her part. Okay. The most common reason I see people come in here is really, truly weakness. It's usually a strain of the muscle, and then it becomes weak over time. So what do we see? We see weakness. We talked about those deep core muscles. Sometimes people come in and they have this deep pain in the side of their hip, and you almost can't find it by poking around because it's so deep. It's actually those deep muscles that we talked about here. The weakness will be also, if it's not, well, it's always here. It's always in the deep core. A lot of times it's a strain of that glute medius muscle. People will have weak feet, you know, they'll tend to pronate. The midfoot, meaning the mid part of your foot is actually, we consider a joint. That is very weak. So what we'll find is, you know, what came first? Did you have a foot problem that didn't allow you to use your glute medius effectively, so then your glute became weak? Or was your hip weak, the glute medius weak, thus causing a problem down in your foot to pronate, so now your foot is weak? So this is very important. We have to work all these pieces together. A lot of people come in, and a lot of times I'm working on feet. I was talking to a friend of mine recently. He actually had a shoulder problem, but a month or two before he had, no, maybe a few months before, he had ankle surgery. And he was telling my husband, we were together socially, and he's like, yeah, I saw Denise for my shoulder, but she worked on my ankle. So you got to look at, you know, where is this really limiting your problem, and what's truly causing that issue? When we see people walking, they have a weakness, the hip drops. So this isn't a great picture, but if you look at the bottom of her shirt, as she's standing on the left leg, it's fairly even. There should be a teeny little drop over here. And that's okay. Here she's on the right leg, and you can see how her shirt is dropped on an angle, that's because this butt muscle, that glute medius, turned off and it's not working so well. It's hard to tell in this picture, but then she has some pronation in that ankle. So the foot falls in. So is it because the foot is weak and it falls in, and then the hip can't hold it together and it drops? Or you land on the foot and this hip muscle doesn't work well, so then this hip drops and then the foot drops to stabilize you. How do we work on that? We work on what we call neuromuscular control, working on getting your foot, your core, and your hips working together with specific exercises. So I don't know if anybody else joined us, but if it's still all women, as you know, we have wider hips than men. And as such, we have what's called a larger Q angle. So this angle from the hip to the knee. Okay. If you look at men, this line will be much straighter. Okay. So this woman had both her knees done. As you can imagine, if you're putting stress and you're always on this angle because of the way you walk or sit or stand, then you're going to degenerate, you're going to wear away the knee joint. But it's because this hip was never very strong, and then the foot wasn't very strong as well. So it's very, very important for women to keep their what we call lateral hip muscles, the muscles on this outside of the hip, strong. If you go on my website, I do have some blog posts with some exercises. Those of you, if you're a member of the Y, they have some wonderful, wonderful classes where we really focus on keeping those hips strong and keep in alignment. Again, if you put your name and email in the chat box, I will send you information on and some videos on some exercises to keep those hips strong. All right, the next most common condition is a tendonitis or bursitis, which ultimately will cause weakness. So you can have it. Tendonitis means you have an inflammation in the tendon. The tendon is the tissue that attaches the muscle belly to the bone. A bursitis is inflammation of the bursa. The bursa is a fluid-filled sac that covers bony landmarks. So on the outside of your hip, right here, there is a bursa. This actual bone is called your greater trochanter. And, you know, as we age, that bursa fluid becomes less and less. And so when people lay on their hip, it becomes a little irritated, and that's why it hurts when they lay on that side. Also, many of these hip muscles attach right at that point. So you get a lot of pain on this side of the hip because the glute medius comes in there and attaches there, the piriformis attaches there, all those deep core muscles attach over here as well. So, okay. So we talked about you could have front hip tendonitis. That would be your hip flexor or psoas muscle. On the outside of the hip would be a glute medius tendonitis. And I've had a few people who've actually had a tear in their glute medius. That older gentleman who commented that now he's got to learn how to walk, where he just did it for 75 years. He had a major tear in that glute medius, so he got it repaired. What else? There's a muscle on the side of your hip called your tensor fasciae lata, or TFL, and that's like right here. I don't know if you can see that, hopefully. That would be, it would sit here on the side of your hip. Yeah, that's the best place to see it. And that's very common, you know, when people have IT band, which is a band of cartilaginous tissue that goes on the outside of the thigh. Sometimes people have pain on the outside of the thigh, or they'll actually feel pain on the outside of the knee. And it's because they're tight in their TFL. Okay. And that's actually where the problem is. And so we need to do some stretching, some soft tissue mobilization to decrease the restriction there. We have to really stretch into that. We have to then strengthen all these muscles up in here. Someone here, as you can imagine, they have could have IT band tightness because it's always on stress and strain because of this walking pattern. And a lot of times it's coming from up in here, which is where that TFL is. We have your groin muscles called your hip adductors, and those on the inside of your thigh. Sometimes people have pain in the groin, and they actually have good joint mobility, so it's not a degeneration in the hip. But you have pain in that groin area, so then you have a groin strain. So we have to work on that. You might have the quadricep tendon crosses the front of the hip, so we have to discern, is it the quad tendon known as your rectus, or is it the psoas? And then, as I talked about before, it could be an SI joint problem, which is in the back. So someone comes in, my hip hurts, where does it hurt? And they point to their back, and it's the SI joint. So we'll work on that. So how do we know if therapy can help you? So we look for, is it reproducible? So someone comes in, it says, the front of my hip hurts after sitting a while and I stand up, but then after I walk, it goes away. Someone says, when I walk and land on my, let's say my right hip hurts, land on my right foot and then it hurts. Someone says, when I run, my hip hurts, but walking is okay. That means we can do something for it. What is not if it's not reproducible, someone says, I can't find a position that's comfortable. Everything kind of hurts. So as an example, about 5-6 years ago, all of a sudden I developed some left low back pain. I'm one of those fortunate people who don't have back pain on a regular basis. And I didn't think much of it. It was okay. That was a Monday. By Wednesday, it was kind of radiating around to my abdomen. And I couldn't quite get comfortable anywhere. By day 4, it just wasn't, I couldn't sleep. It just was this dull ache. And some times it wasn't sharp, but it was just achy and painful all the time. And there was nothing I could do for it. So I knew it was not reproducible because I couldn't find a good position, and I couldn't stimulate the pain. So, sometimes if I poke somewhere, I'm like, oh, that's where the pain is. This was, where the heck is it? So I knew it wasn't musculoskeletal. So I told my husband, there's something else going on. We went to the hospital. I told him it's not reproducible. It's not musculoskeletal. Because it was my low back, they worked me up for a kidney stone. By 2:30 in the morning, they didn't know what it was. All the tests were fine. They sent me home with Vicodin. They said it must be musculoskeletal, even though I told them it wasn't, and I wasn't going to argue. So, it got better over a few days. So about a week later, on a Tuesday. So my pain initially started on a Monday, the Monday before, a week, over 8 days before. I scratched my back and I felt a rash. So I had shingles. I had nerve pain before the rash showed up. Very hard to diagnose. It's not something we typically treat in physical therapy. That's something you need to go see your doctor for. However, you go to the doctor, you get some medication. Antivirals help a lot. But to really help with that nerve pain, acupuncture is very helpful. And then some of the non-traditional therapy, manual therapy I do will be helpful for it as well. And as a side note, a few years later, I started itching back there, and my doctor's like, oh, that's the shingles kind of re-aggravating. I took the antiviral and it went away. And then earlier this year, I developed some sciatic pain in my calf. And I never had sciatic. It's kind of weird. And then I realized, oh, this is the shingles acting up again. And I took the antiviral medicine and it went away immediately. It was crazy. Now, probably that's not something you want to do without talking to your doctor first. However, if you've had shingles in the past and it was in your low back, that sciatic nerve can become affected. So make sure you let the doctor know that, could this be shingles reactivated? So those are things we'll look for. It's very important to know what the diagnosis is, because that will tell us what exercises that you need or can do. There is overlap among all the diagnoses, but we really want to understand what's going on. And what is the biggest mistake people make with hip pain? They ignore it. If you can get in to take care of your hip pain sooner than later, it will go away a lot faster and we have much more success with it. You want to really take care of any aches and pains that just aren't going away after a week or two. You really want to get it checked out. And I'm happy to say here in Illinois, you can see your physical therapist without a prescription from your doctor. However, if you are on Medicare, you still need to let your doctor know what's going on. They may want to see you first because they have to sign off on my evaluation. So you really need a prescription if you have Medicare. Otherwise, you don't. Here is someone who came in to me with hip pain. She had been having, I think she was a nurse. She had a pretty busy job when she was younger. And for years, she loved to walk, but then she couldn't do much. So she says, yesterday, for the first time in several years, I was able to travel downtown and visit the Art Institute. There was a lot of walking and sitting activities, which previously caused me to be in pain for several days afterwards. But today, I'm just a little sore. So we worked with her for quite a while, and now she's very functional. And this was a few years back, and I know she hasn't had surgery yet, and she's doing very well, and she's working with a personal trainer to keep strong. I think this is my friend wrote this about how she aggravated her hip because she did too much too soon. I just had another young woman, 50 something, she came to me with hip pain. I don't remember what the hip pain was from. But it was her deep core, right? Those deep core muscles, we had to get those stronger. And the hip pain pretty much went away. She started increasing her activity, and she decided to she had only been doing walking a little bit in some of her exercises. And then out of the blue, she decided to do a power walk for 5 miles, 3 days in a row. It reactivated her hip pain. So she came in and we talked about that, and we got things settled down. You don't want to do too much too soon. Even though you feel good, like my friend, I don't have pain. I'm, healthy. I can handle this. Even walking too much can aggravate and cause an overuse problem, not just a running or very active sports. So what can we do, and how do you heal your hip pain naturally? We do hands-on manual therapy where we work on the tissues, and we'll use some traditional approaches and some non-traditional approaches. Exercise is very key to promote strength in your core, legs, and feet. We need to get as optimal mobility as possible in your hips, spine, and ankles, and really work on your balance. And then getting everything working together, your feet and your core is very important. Sometimes medication is needed. Sometimes a shot is needed. Although I have to tell you, with hip pain, people don't need a shot so readily, and medication doesn't help a whole lot. Anti-inflammatories, it might help control some of the pain, particularly if you have pain while sleeping. But you really just need the exercise to get stronger and really relearn how to move and not aggravate your pain. In fact, I had a woman just come to me a couple weeks ago. Karen Brownlee sent in this woman, and she'd been having leg pain, in her hip, in her leg, down to her ankle and foot for the last year, but just kind of dealing with it. And you would think it's coming from your back or your spine, because she also said some numbness down in her foot, but it didn't fit with the typical spine symptoms or back symptoms. What we found was, she crossed her legs all the time, and so she was stressing and straining those lateral hip muscles. Remember, the woman picture of that deep angle. She walked like that woman where her legs kind of crossed in front. So she kept overusing those lateral muscles. And her foot was very weak. So if you watched her walk, her foot really turned in. And when she laid down on her side, that foot really hung kind of like this. So the muscle and nerve down in the bottom of her calf, the side of her calf, was getting stressed and strained. All I told her to do the first time was don't cross your legs and sit with your feet flat on the ground. And she felt maybe 25, 30, 40% better. And then the next visit, I told her to sleep with a pillow between her knees and her feet so that foot wouldn't hang like this. It would be supported. Now it's about 2 weeks just from changing positioning. We talked about walking, and she's almost all better. And she's lived with it for a year, so don't wait too long. Okay, so as a thank you for coming today, I'm offering a free phone call or a telehealth session to discuss your issues. You can call my office and my admin, Jenny, can set you up for a 20-minute phone call with me or Kevin, and we can go over what's going on and give you our opinion on what's happening. If you leave your email and your name in the chat box, I can send you some ebooks, some videos, and some information that will help you. And these are links to some blog posts that I have written talking about hip pain and managing it. Again, this is that ebook. And there's my information. Denise@themanualtouch.com. Feel free to email me. My phone number is 847-541-7600. My website is themanualtouch.com. Go ahead and check it out. Okay. Does anybody have any questions? Let's see, I have a couple of names here. I don't see any questions in the chat box. Anybody else? Anybody have any questions they'd like to go over? No? Okay. Let's see. Normally I can copy your emails. I got 2 emails. If somebody else wants to give me their email, I'll get it.
Denise, I have a question.
Yeah, go ahead.
In regards to the sit bone, my pain kind of goes from the hip, but a lot of it comes from the sit bone right there where the hamstring insertion. Do you think that there's some related? And it's been a long time. I've done everything, and
I didn't talk about that, but sometimes, where's your pain? Just the sits bone or anywhere else?
it's in the sit. I do have some like piriformis, and like when I work it out with therapy balls and so forth, it gets a little better. But mostly it's a sit bone and that insertion right there with the hamstring.
So what we have to differentiate, is it a hamstring problem or is it actually coming from your spine? I have had people with stenosis, which is very, very rare and unusual, that they have pain at the sits bone.
Okay.
So, we'd have to kind of evaluate you to determine which it is. Okay. And then that will determine how we treat it.
Okay.
Okay, but it's if nobody's taken a picture of your spine, if you haven't had an MRI of your spine, or probably it'd be better to come in.
I had it of my hip. I had the MRI of the hip, but it was many, many years ago, and it was just gluteal tendinopathy. That was the diagnosis.
Ah, okay. And that's that glute medius we talked about.
Right.
That's weakness. So if you never quite got it as strong as we want it, or really learn how to integrate it again, even though we're doing bridging and you're probably doing a whole ton of stuff.
Right.
Something else might have gotten aggravated. So
got it.
Yeah.
Okay. All right.
So I would come in and there's no reason to live with this. Let's figure it out. And,
got it. Okay. Great. Thank you.
You are quite welcome. Sorry, usually I can't seem to copy the chat box, so I'm writing people's names down here. Any other questions?
Thanks so much. That was really great.
Well, thank you. Appreciate that.
Very much.
So the video, Debbie will put it on the YouTube channel, and then you can watch it again or let people know.
Yeah, thank you, Denise. It was very interesting. Even for me too, I'm starting to get a little of that in my upper 50s, and the heads up is helpful. Thank you.
You're quite welcome. You're quite welcome. Okay. All right. Debbie, don't close me out yet because I'm still writing this down, but thank you everyone for coming. I appreciate it. And I really appreciate the Y for letting me educate people. This is my favorite thing to do. Our biggest role is educating people on how to move, because they really should have a class in school on how to sit and stand and move. And they just don't, I get these young women who get out of college and then they're sitting at a desk and they're like this, and they come in with neck pain and shoulder pain and back pain. And it's just from weakness and not learning how to sit and move. So.
Excellent. Well, thank you so much. We appreciate having you be a presenter on the YES series.
You're quite welcome. Thank you. And maybe I'll see you at the Senior Palooza.
Oh, absolutely. Let me know when you're done, Denise, so I don't end it for.
Okay. And you go by Debbie, right?
I do.
Madeley. Okay. Got it. All right. Thank you.
All right. Thank you. Have a great day,
Have a good
everyone.
everyone.
Bye.